Good morning, good afternoon, possibly good evening. Welcome to Muscle Management for Elbow Pain. I'm Tom Sayers and I'm your host. Whether you have carpenter's elbow, tennis elbow, climber's elbow, golfer's elbow, doesn't really matter. It's been labeled some type of situation and the commonality is you have pain in your elbow. Fortunately, there are oftentimes muscular components that are contributing to that pain, much like any pain throughout the body. And you can manage that, reduce those problems, and oftentimes you can get the pain to disappear. So fortunately, there are three muscles that are very commonly contributing to this problem. The triceps, specifically the long head, where it comes up off the elbow and attaches to the scapula. The teres minor and the teres major, which are run from the scapula into the humerus. What's interesting is as the tricep goes up to the scapula, it interlaces between the teres minor and the teres major. What often happens is those muscles where ideally they can slide back and forth on each other, what often happens is they get adhered, they get stuck to each other. What happens often after that is you might feel a little tension in your shoulder. More often than not, the pain lands down, the tension lands down in your elbow. And fortunately, this is something we can manage and reduce. So I want to show you two techniques for this. One is basically what's called a pin and stretch. I'm going to reach under my arm, find my scapula, move up towards the top edge of it. I'm going to use one finger in this case. I'm going to push in while I rotate my arm. Just enough pressure to feel like I've made contact, that I feel like I have the bone under there. Move the arm around, okay? Move down a little bit, press, and move. Maybe move down a little further, down, and move. Okay, now, second technique. I'm going to use three fingers this time. It's kind of a nudge, a cross fiber technique, if you will. Up under, find the scapula, get close to the edge, and my pressure is going to be in and that way. So in, over. Maybe move in a little bit. That's it. They're simple, they're oftentimes effective, and fortunately they're easy to test. Be patient with yourself. You may not notice pain reduction immediately, but you probably notice some pain back here when you're pushing. That's usually an indication that those muscles are involved. Now I've got more information at musclemanagement.com in the self-help section. Cruise it. I think you'll like it. Fortunately, upcoming are going to be some presentations on foot pain, and I'm talking pain around the big toe, which is often labeled bunions, on the bottom of your foot, which is often labeled plantar fasciitis, and our old pal shin splints. I'll post something here on YouTube when those are ready to be viewed. It's all useful information, and remember, you can do something about your pain, and oftentimes it doesn't require surgery, it doesn't require special shoes or a toe spreader or any and all of those things. Oftentimes there's a muscular component, and the muscular component is oftentimes the core issue of what's going on. Take care of that, pain's gone. Hope you have a nice day. Enjoy, and remember, you must be present to win.